Rob Katz has just been appointed to General Counsel in the White House Office of National Drug Control Policy under President Joe Biden. He is the former attorney for the New York State Office for Addiction Services and Supports, known as OASIS. He is also a believer in the beauty of recovery from addiction.
I'm an attorney, and I just recently started a job as the General Counsel to the White House Office of National Drug Control Policy. This I started 2 weeks ago. Prior to that, for most of the last 13 years, I was the General Counsel at the New York State Office of Addiction Services and Support. So I was the chief lawyer there for, I'm superstitious, so I left before my 13th year. And I was offered an opportunity at the end of December to join the Biden-Harris administration. If I wanted to be considered actually on Christmas Eve in an email. So it was an interesting holiday season. What started a process, and it was a process. So it took about a month and a half to finalize. It impacts in so many ways, and it impacts not just the person, but everyone around that person. So it disrupts family relationships, they lose jobs, they end up many times getting arrested, given the kind of drugs that are on the street right now. They can overdose, some can overdose and die. So it's, and then it impacts everything about the family. I've met so many families over the years, and they tell you these stories about, their loved ones, stealing from them. And it causes people to do really bad things, even though I don't believe most people are bad people at heart, but people can do some pretty bad things to each other. And so it just impacts us in every single way. It's tough though. I mean, these medications, and that's how a lot of folks started, unfortunately, and they're highly addictive. And we're in the middle of this opioid epidemic. It's not so much prescribed opioids anymore, but that's certainly where it started. And there are so many folks who became addicted. They were overprescribed pain meds, became addicted to them, then couldn't access them and started using illegal drugs. And and they're just, the drugs that people use right now are just lethal. So, and they become more lethal every day. So, and it's a struggle. It's folks in recovery talk about one day at a time. And so, it becomes a lifelong struggle, but people do amazing things as well. From drug overdoses, and actually some of the preliminary numbers we're seeing, and there's been an impact because of COVID-19, but it's probably going to be in the 85,000 range for this next cycle. The next reports will come out in the next couple months. One of the stats I looked at when I was at OASIS over the decade of 2010 to 2020, we lost about 500,000 people to drug overdoses in this country. That what we're going to try to do in Washington will help, and help the states do what they need to do. But there's no doubt that isolation is not helpful to people who are struggling with drug and alcohol addiction. And we've all been isolated for almost a year, or most of a year at this point. And it makes it that much worse. And then, it's impacted people being able to get help, because there's, programs couldn't operate at full capacity because of the potential transmission. So I'm hopeful, and I'm optimistic that, what the president is doing right now, trying to get everybody vaccinated and trying to get us all back to normal. I'm working remotely, by the way. So in terms of impact, I haven't been in an office since I left OASIS in April of 2020. I had a different job with a national health organization. But even with this job, basically I'm working remote for a number of months until it's safe. My assumption is that until everybody's vaccinated and it's safe for people to be around each other. So the Office of National Drug Control Policy, I mean, we're not in the White House, but we're on the grounds of the White House. So we're in government loves acronyms. So I'm in what's called the EOP, or the Executive Office of the President. There's a number of operations that report directly to the President's office, the White House. And so our agency or office is charged with trying to coordinate all the work related to drug, trying to stop drugs from coming in, trying to prevent people from using drugs, and trying to help people who've become addicted to them. So we coordinate the activities on behalf of the President with all the other agencies at the federal level who have a role. So Centers for Disease Control, Food and Drug Administration, Health and Human Services, Drug Enforcement Agency, the Attorney General's office. So we try to bring everything together and make sure there's coordinated activity so that we're all moving in the same direction so we can maximize our efforts. My wife would tell you I cried. So I love Joe Biden. He and I are both Syracuse University College of Law grads. I just believe he's an incredibly decent human being. I think all of us can he's genuine, and I think all of us can feel, what he's gone through in his life. Now he cares about people and his compassion. And on our issue in particular, his son has struggled with addiction and has been to treatment. And so he understands that as a family member. But so so first off, I admire and respect the President. Now I'm working for him. And then that's it, I'm working in the White House. I mean, that was never in my dreams growing up. So it was a pretty cool thing when they called, and it was really cool when they said, we'd like you to come and join the team. I can't wait till I'm actually working in the White House physically, but it'll happen in the next number of months. But I'm actually, right now, I'm in upstate New York, where I've been for I've been there most of my life, but all my life, actually. This will be the first time I'm living in another state, because we're going to move to the DC area in the next number of months. Because at some point I will be expected to be in the office. It's a good change. I mean, we have 2 sons, and they're both in their 20s, so they're looking forward to it. And, my wife, her company, she's telecommuted for like 4 years now. So she's used to what's been going on since COVID. But her company's headquartered in Rockville, Maryland, which is right near Washington, D.C. So, and I think, and we both love New York State, but I think we're tired of the upstate winters and the snow. The more people can learn and understand about addiction, that it's not a personal failing, it's a medical disease, and understand that people who's perfect. Nobody's perfect, right? We all make mistakes. The more we can understand it and treat it like a medical disease, the more we can show compassion for people who are struggling with addiction, the easier it'll be for people like me and others to create policies that actually have a good impact, because we don't treat it. For far too often, a good part of the problem of why people don't get help is the stigma associated with coming out and telling people you have an addiction. And, it impacts your family life, it impacts your job, it impacts everything. And so the more we understand it's not a personal failing, the more we can just learn and then help others learn, and the more we can just show compassion to our fellow citizens, the easier it'll be for us to do what we need to do, and the better it'll be for people who want to try to get help and get better. In the work I did at Oasis, I would help families try to get loved ones into treatment, and it was all the way from teenagers to senior citizens. And it was people homeless living under a bridge and people living in penthouses. Just ran the gamut. Didn't discriminate. impacts everybody. What I've been saying a lot recently, it's like, because we try to stop drugs from coming into the country, and we should, and we try to arrest people who are selling drugs at a major level and trafficking drugs. But there's a demand for the supply that comes in, and the demand isn't because people are, predisposed to becoming addicted to substances. It's they use them for a lot of reasons. They've been abused. They've been neglected. They're in pain. They have mental illness. They have no opportunity. They have no hope. So there's all these other things that are at the root of why people use substances that we need to spend time on. Because, I've been saying to the folks that I'm just starting to work with, if we could ever get to a point where people don't feel the need to use them to feed some pain or something that's missing in their lives, the supply won't come in because there won't be a demand for it. So that's the kind of stuff we have to work on. And that's one of the things I'm really, because the other thing is there's a huge component of drugs and drug addiction where it's been criminalized, and so many of the folks who suffer the consequences, the criminalization, are Black and brown people. And we've put so many people in jail or into forced treatment, and we just set them up to fail. We take their opportunity and hope away. It's not even, prescribed opioids on some level, but not as much. Heroin, not even as much. It's fentanyl, which is just, it's illegally developed synthetic fentanyl, which is an opioid, which is more toxic and lethal than heroin and morphine and all the other opioids. And it's getting mixed into other drugs. And that's what people are overdosing from right now. We all hear about these celebs who pass at a young age from drugs and alcohol. But like I said earlier, right? There's something going on there. There's a pain, there's a mental illness, whatever it might be. There's a bad relationships. There's a reason people use substances, and it isn't because they're genetically predisposed to becoming addicted. That's not why people use substances. They use them primarily. You hear it from so many folks. I've heard it from so many folks, thankfully, who are in recovery. They used substances to not feel the way they felt most of the time. It helped them escape. It helped to take them out of feeling pain and feeling the way they felt. And that's the stuff we have to work on. And that's hard, but that's way beyond, drugs and alcohol. It's way more about society in general. It's scary, but but people get better too. I can give you a great story. So I have a colleague up here in Albany, professional, really bright guy, good family, calls me. His son has some mental illness issues, and he started using drugs, and he's worked his way up to using heroin. And we got him set up to go to treatment 3 times, residential treatment. He walked out of 3 programs. But they came back a 4th time, and he went, and this time it worked, and he stayed, and now he's studying to become an alcoholism and substance abuse counselor to work in the field. And he's been stable in his recovery for 2 years now. So those are the things that drive me and motivate me. I see what happens with folks who find their way there, and they just do amazing things. There's a movie called Beautiful Boy, which if you haven't seen it, I'd recommend you take a look at it. It's actually a book, and it was written by a reporter named David Sheff, and it was about his son, Nick. And Nick ended up getting addicted to methamphetamine and other substances and struggled for years. And it just, the movie and the book talk about all the pain that they caused each other and what happened. So I met Nick like a year ago, and he talked about how, and he's now almost a decade into stable recovery, and he's now writing screenplays in Los Angeles, and he talked about how his doctor had said to him how much she loved working with people who have addiction issues. And he asked why. And she said, when I help somebody with another medical condition, the goal is to get them back to normal. And he said, but when I work with somebody who has addiction issues and we get them to stable, their lives go way beyond normal. They go to places that nobody ever thought was possible. And so she talked about how amazing it was when somebody gets there, all the great things they can do in their lives that they never thought were possible. So that's the kind of stuff that motivates me. I think it motivates a lot of people who work in this stuff, work in this field. It's sad, but Nick's alive and his dad's alive, but it's painful. It's probably the most real. I've been around this for almost 15 years now, and I've met a lot of families and a lot of people who are in recovery. And if you sit and listen to them and then you watch this movie, it's probably as close to what they talk about having gone on in their lives. I hate the movies where, classic Hollywood, somebody dies at the end. And it's just, that's not the world, right? A lot of people recover and a lot of people go on and do amazing things. What's painful, and you hear this a lot from families, is you can't make somebody get better. They have to want to get better. And so the inability to help control somebody else's life is frustrating for a lot of people. But, you just have to, it's like I said with that one story, somebody said, why were you there the fourth time for that young man? I said, because he asked. You always, not everybody's going to make it, but you have to hope and pray they will, and you have to do everything you can to give them that chance. But ultimately, it's like with that family, they would see me and say, well, you saved our son's life. And I was like, no, I didn't save his life. I just created an opportunity. He saved his life. I didn't do anything. I got you a spot in a treatment program. He saved his life. He did the work. But and that's just it. It's up to the individuals. And sometimes they're not ready right away. But you have to keep trying. You have to be there.
On March 10th, it was announced that $50.7 million in federal funding is coming to the State Office of Addiction Services and Supports for healthcare providers across the state. A group on Long Island is getting $5.7 million as part of this announcement. The funding is to carry out prevention, treatment, and recovery services. The money comes through the federal government's State Opioid Response Grant. Robert Kent, formerly of New York State's OASIS, now sits on the White House Office of Drug Control Policy. He, among many other advocates in New York, are helping the many individuals, families, and communities in need. We have them all to thank for their advocacy.